Well, Secretary of Health and Human Services Robert Kennedy believes that things like lab samples and prescriptions, can be delivered, that robots can give ultrasounds to women, and that AI avatars can help fill in other gaps. Chad, on the surface, this feels a little bit like the Jetsons, but it is something, right? Something to help with the crisis in rural healthcare. What do you think?
It is, and I think that the key quote, I guess, from Dr. Oz is that the purpose of this fund is not to pay operating expenses, it's to deal with the fundamental hindrances of improvement in rural healthcare. And so I kind of interpret this as if you see this as kind of a stopgap to Medicare or Medicaid cuts, it's not that. It's really about using rural communities as laboratories to see what new technologies will be most effective in the future. And in some ways, I think that's actually kind of exciting to find out what is going to be effective. Some of the things that you had mentioned, like these drone deliveries and expanded telemedicine and using wearable technology to diagnose what problems are. And so I think if you view this as a substitute for Medicaid, it's going to fall short. But if you think about it as a tool for trying to understand how to transition toward the future, it has some potential.
Yeah, for experimentation for the rest of the country too. Yeah. Rick, where are you?
Well, I think AI is a very valuable tool depending upon how it's used. AI can be used for good or for evil. In this case, I think if it's being used for mundane tasks or doing a lot of things that are missing from rural healthcare settings, it makes sense. It doesn't replace human interaction. I think in those cases where people are using AI, whether it's as their therapists or their confidants, that's where AI really gets into a problem. So if this information that AI collects and is doing in rural areas goes to people with expertise, I don't have a problem. If this is just being used by individuals to diagnose their own problems and come up with solutions, then I think it's going to fall short.
Yeah, but Anirban, we're already using technology, not necessarily to diagnose, but to monitor things like blood pressure, heart rate, cholesterol levels, and so forth. Isn't this sort of building up on that?
Sure. I mean, AI can be used in extremely intelligent ways, and we have a couple of projects that are going on. They're finding great advancements in, for example, diagnosing certain kinds of cancer, especially breast cancer, way earlier than anybody could have diagnosed, like a human mind could have, because AI can see pattern and data through it. But yes, I mean, I do think that technology can be used in interesting ways, but I also think we should not forget that we should provide real incentives to doctors to go and work in rural areas. There are programs where you kind of write off the debt and so on. It's not as a substitute for the personnel. It's more like a complementary thing that doctors will work with AI and things like that for wearable things and other kinds of diagnosis. With that, I do think that it can. But again, AI hallucinates. AI does wrong things.
Yeah.
You need a person to be there to understand when it's hallucinate, who is actually an expert, right?
But that's how we got here in the first place, the fact that there are doctor shortages. So where's this money going to come from for getting more people there? We have a minute left, Tara.
Okay, well, the federal government does have a program recently, and I apologize, I don't remember the name, where basically it's a pot of money, rural communities could apply for the money, and they can use that money to encourage providers to come to an area. But the thing of it is that this money doesn't necessarily come without strings, because part of what has been happening is for communities that have received these grants, basically they've been told, you have to jump on board with the, no sweets under SNAP or with the President's Fitness Program, et cetera. So there's a yes and a no there.
Yeah.